Hi there, I'm Kristen from Into the Light Healing and Bodywork. This yoga session was created for people with low back pain from diagnoses of stenosis, spondylolisthesis, spondylolisis, instability, osteoarthritis of the spine, and degenerative disc disease. This is not a flow for people who have disc herniation or suspect it. Right, well, let's get started. All right, we're going to get started laying on our backs. And we're going to keep the knees bent up towards the ceiling. And we're just going to do a little bit of pelvic tilting here. So you can put your hands on your lower belly, and then when you breathe in, fill your belly up with air, and it's as if you have a balloon down there and you're trying to inflate it. Belly goes to the ceiling. And then as you exhale, you're going to squeeze that belly, squeeze the balloon, and you're going to tuck the tailbone under, so it's kind of like you're curving your tailbone up towards the ceiling. As you breathe in, you're going to relax your back and inhale, fill the belly. Breathe out and tilt. Inhale, fill the belly and relax. And breathe out, tilt the pelvis. Keep flowing with your breath here. Don't worry about keeping pace with me. Put your arms wherever's comfortable. Try to control the motion. So there's no like tilting, rocking back and forth. Notice you're holding tension in your neck. Bring your chin towards your throat and then lift your head up and put it back down. Do two more. Great, so we'll relax back to neutral. And then we're going to bring one knee above the hip. So just tighten those belly muscles and bring one knee above the hip. Leg is just kind of relaxed. And then you're going to put it back down. Make sure you're keeping your abdominals tight that whole time. And you're trying to keep your pelvis level, so you should feel the sacrum, your tailbone, even on the ground while you move your leg, and it shouldn't be like rocking back and forth like that. So try to keep it nice and stable by engaging those abdominal muscles. Breathing out as you do the work. Breathing in as you return to center. We're going to march opposite leg. Repeat on the left. If it's really easy for you to keep your pelvis stable and do this motion, the next challenge would be to bring both knees above the hips and then keep the belly tight as you tap one foot down to the ground and back up. Other foot down and back up. Make sure you're keeping the pelvis level still and listen to your body here. So whatever level you are at, it's okay. Just work with what you have. There's no point in exercising in a manner that compromises your form, and you're just exercising into poor form. So it's not really helping you. If you notice your chest is pulling up towards your knees, it's probably a little bit more strain than your body is ready for. So go back to the first mode. If you're doing the other, and if you're doing this mode and it's too hard, try doing just little lifts. Small, not even coming knee above hip. Okay, so next we're going to bring our chins to the chest, And then we're going to reach alternately for the ankles, so opposite ankles. So left hand goes to left ankle by crunching the left side body. And then right hand goes to right ankle by crunching the right side body. You can move here, breathing in, coming back to center, breathing out, going to the side. So breathing in, breathing out. Or if you want to get a little bit quicker pace going, you can go breathing in, breathing out, breathing in, breathing out, breathing in, breathing out. Always listen to your body and do what feels right for you. There should be no increase in pain. Your abdominals are tight. Taking a break when you need one. So for the next one, I'm just going to show you real quick something you can do maybe at the end or after you practice today, is bringing your feet onto a wall. So let's just bring the feet to the wall here, and you want your bottom to be about your shins distance from the wall so that your knees are above your hips. And you'll just press your feet into the wall, and it kind of engages your lower abdominals and lifts your bottom just a little bit, and it takes some pressure off the low back by performing a little traction. So this is just a nice resting position for relieving pain. So you feel free to use that at any time. For our practice, we're going to come back onto all fours here. So we're going to do a modification of cat-cow. So wrists are going to be stacked underneath the shoulders, and knees are stacked underneath the hips. What we'll do is breathe out and curve the spine, starting with the tailbone. We're going to point the tailbone down. Your back curves up towards the ceiling, and then we're going to let the head relax down towards the arms, in between the arms. And then when you breathe in, we're going to uncurl that tailbone, stick it back towards your toes, and just have a nice straight back, long spine. You're elongating from the top of your head away from you and from your tail away from you. So breathing out, curving the spine. This is cat posture. And breathing in, coming back to a neutral position. Make sure you're lifting your head up here and not letting yourself sag down like so. This is table posture. Breathing out. So flow with your breath here. Again, any pinching or anything like that, you need to make a modification. So find something that feels right for your body. And then let's stretch out right arm and left leg, or you can just choose one if it's too difficult to balance. And then if you're able, let's bring the knee and the elbow together and crunch together. 1, reach out. 2, reach out. Make sure your head is lifted, back of your head goes up towards the ceiling. And 3, reach out. And come back down. Switch sides. Left hand goes forward. Right heel goes back. Exhale, crunch, and bring knee to elbow. Reach out. 2. Keep integrity through your shoulder. Push away from your yoga mat. And 3. Good. Reach out. And then point. Okay, so next, we're going to come back onto our heels, tuck your toes underneath, and then walk your hands up. This helps to stretch the plantar fascia on your feet, so it might be pretty intense, and if it's too intense and uncomfortable, feel free to come to the tops of your feet. So we're going to interlace our hands behind the back and then walk the knees a little bit wider apart. Nice tight tummy here. And we're going to drop down, forehead to the mat. And then come back up. If you can only go halfway without pain, then just go halfway. Alright, so we're going to bring your hands down and walk them forward. And tuck your toes under if they're not already there. Lift your knees, hover above your mat. 3, 2, 1, nice tight tummy, and then lift all the way up into a downward facing dog. You can pedal it out a little bit here, get a little stretch through your hamstrings. And then come to stillness. Relax through your neck and push your shoulders out of their sockets. Kind of push your hands away from the yoga mat. And let your tailbone point up towards the ceiling. Next, we're going to step into a warrior one with the back heel lifted. So bring your right foot in between your hands. We're going to keep, like I said, that back heel lifted. And then we're going to come up with our hands together here. Try to think about bringing your right sit bone back towards your left thigh. Keep your right knee above the right ankle. You can bend your left knee a little bit if it feels like you're creating a forward rotation through your pelvis and arching your back. You can just bend that knee a little bit, tuck your tailbone under, and that will create a more neutral spine. Okay, now we're going to plant the left heel behind and rotate our pelvis so that we're facing the left side of the mat. You do want to keep that right knee over top of the right ankle and keep your torso over top of the pelvis. A lot of times our bodies tend to kind of shift forward a little bit, so just check in with yourself and see where you're at and see how you can comfortably get back over your pelvis. So knees tracking out towards the pinky toe on the right side, and we're going to bring our arms up, elbows facing the ceiling, turn the palms down, bring your head back over top of your shoulders, and then turn your nose to look over that right fingertip. Option to lift your right heel here, and then lower it down. Very nice. Okay, next what we're going to do is cartwheel our arms down, plant your hands on either side of the foot. I'm going to turn the left foot and then lift our right foot back up and into downward facing dog. And then bring the left foot up in between the hands. We're going to keep that right heel lifted. The left knee should be above the left ankle. Nice tight tummy as we lift up for warrior one. Again here, you can tuck the tailbone by bending the knee. This is too much stretch on your right hip flexor. Lift your toes and then gently place them back down, no gripping. And then we're going to open out into warrior two. So plant your right heel down, and you want your left heel to be in line with the arch of the right foot. And pelvis is right underneath that torso, opening that left knee out towards the left pinky toe. And getting a nice rotation here. Arms out, elbows up, or elbow creases facing the ceiling, and then turn your palms down. Bring your head back and turn to look over your left fingertips. Great job hanging in there. All right, let's bring our hands down to either side of the left foot. We're going to lift back, foot back, and then we're going to come down onto the knees. Bring your bottom forward so you have a straight back, straight spine, and in line with the legs. And then we're going to lower down, keeping on the knees here. And then pressing back up. And we'll do that 2 more times if you're able to. If not, it's okay to rest in child's pose. So from here at a half plank, we're going to lower down and press back up. Holding at the top of the plank. And then lower down and press back up. Nice tight tummy. Great job. Holding here. Tuck your toes under, they're not there already. And then we're going to lift up off the knees and into a downward facing dog. Okay, so from here, going to walk our feet all the way up into a standing position, or forward fold I should say. And then with a nice tight tummy, we're going to curve the spine as we roll up 1 vertebrae at a time. And then from here, we're going to take a wide stance, just like the warrior. So the heel of the left foot is in line with the arch of the right. We want straight knees for this one. And sorry, your right foot's going to be angled out just about 45 degrees. So we want straight knees for this one, but the pelvis is rotated towards the direction that your left toes are pointing. Okay. Excuse me. We're going to open from there. We're going to open out to the right side of your yoga mat. So knees are straight, arms come out. We're going to shift our torsos forward, and then we're going to drop down so that the hand comes to the thigh or the shin, and rotate the torso up. Turn your head to look at your right armpit. And as you breathe out, we're going to come down. Right hand is going to go towards the left foot, and then the left hand is going to go up towards the ceiling. Again, look at your left armpit if you are able to, but if not, please look at the floor. And then we're going to come out of that one and step that right foot up. Bring the left foot back. Okay, we're going to do the same thing other side here. So turning that pelvis open to the left side of your mat. Track that right knee out. Don't let yourself collapse in like so. And then we're going to bring our arms out to the sides. Straight knees. Heel in line with arch. Shift forward. And then rotate down. Head turns to look up at the left armpit. Drop your left hand towards your right shin. Turn the right hand up towards the ceiling. Look at your right armpit. And then drop it down. We're going to step the left foot forward and come into a forward fold. From here, bring your toes together. And then bend your knees so that your bottom's going down as if you were about to sit in a chair. We're going to inhale. Nice tight tummy. Bring the hands forward and up just as far as you can go comfortably while keeping a flat back. Option to shift your weight forward onto the balls of your feet and lift your heels here. Nice tight tummy. And then sink a little bit lower if you can. And then straighten up, bend forward, and then come all the way down onto the ground. And let's bring our legs out wide. Okay, so here, if it's not comfortable for you to sit like this, you can grab a block and sit on the block so that it lifts your hips up just a little bit. And we're going to bend forward. Rolled up towel works too, or blanket. Remember, we're bending from the hips. And then walk your hands to the right foot. Nice tight tummy as you kind of twist a little bit here. Only move as far as you're able to without an increase in pain. And then we're going to walk back over to the left foot. And then back to the center. And then walk the hands back up. Remove your prop if you have one. And then come into lying on your back. To get there, you can do knees bent, and then take your hands alongside of your thighs, and as you slowly lower down, keeping your abdominals engaged, and then one vertebrae at a time comes down to the floor. We're going to take the right ankle and put it on top of the left knee. Take your hands and put the right hand in that little triangle that is made from your legs, and put one hand through there, and then the left hand will go to meet the right hand behind the thigh. Option to push your elbow into your right knee here and get a little bit different stretch through the right buttock. Or option to straighten the left knee and get an additional stretch through the left hamstring and the low back as well. Whatever feels right for your body, what feels the tightest is probably what you should stick with. Try to let go of any tension, just feeling a good strong stretch. And then bring your foot down, and we'll bring the right foot down, bring the left foot onto the right knee, and interlace the hands behind the right thigh. And then you might notice a difference when you repeat the same thing on this side. Feels a little bit different location of stretch, or different intensity of the stretch, and that's just because we don't do everything in a very balanced manner in our lives. Most people have a right-handed or left-handed tendency, and we use one side more than the other. That's why it's nice to have a yoga practice or any exercise practice that we do to kind of rebalance ourselves and make things even again. All right, let's release that one. And then let's bring the heels of our hands into the crease in the groin here, and let's press the hands away from our shoulders, and you can kind of lift with your head a little bit, bringing the shoulders even further, elongating the spine, and then lift your head and bring it back down. Relax your arms. If you would like to and you're comfortable, go ahead and stretch out your legs. And let's just take this moment to let our bodies relax, to notice what we feel, and just let go of any tension that we may still be holding. Let's call to mind 3 blessings in our lives. 3 things that you are so grateful for. Notice how your body feels as you think about these blessings. Notice how your body feels after the yoga practice we just did. See if you can intentionally let go of anything that you're still holding on to that is no longer serving you. Bring our hands together, bend up our knees, roll on to the right side. From here, we'll push up into sitting in a comfortable cross-legged seat if you are able, or up on your little prop. Bring your hands together at heart center. Thank you for choosing this practice and for making an effort to improve your body. Let peace be with you.